Good afternoon. I want to thank everyone for joining us today. As we've been through this evolution over the course of the last year, this is one of the first times I feel like we're coming to you with a series of things that are generally good news. We are making considerable progress in our fight against COVID-19. Now, we remain very cautious and we continue to reiterate with the public, despite the progress we're making, we have to continue to do the things we've been doing, wearing masks, avoiding high-risk settings, physically distanced from non-household members. The success we're having is not in spite of those efforts, but because of those efforts, and we want to see that continued progress. But as we come before you today, our case counts are down significantly. You have to go back to last fall to see individual days with case counts as low as we've had, along with percentages of positives. Our hospitalizations are going down. And even with the interruptions in the last few weeks in the availability and supply of vaccines, we are getting vaccines in arms at a very impressive rate. Today we are reporting more than 783,000 vaccines administered, which means that 1 in 5 San Diegans, 20% of San Diegans, have received at least that initial first dose. We have almost 68% of our seniors have been vaccinated. All of our long-term care and skilled nursing facilities have received at least their first vaccine. And we are making considerable progress. We see the progress around youth sports. We're incredibly encouraged by recent news by school districts that are planning and preparing and getting ready to open, some as early as the beginning of April. And we know that we are descending through the tiers and are looking forward to, in the coming weeks, if we can keep this trajectory going, the prospects and possibility of descending into that red tier. And so this is all encouraging, and San Diegans should be commended for the position we're in. But again, we want to keep it going. We don't want to lose our focus. We don't want to lose our vigilance, and so we want to continue to see the progress. But a part of this progress and a next step that we're preparing to take is to move into the next tier or next group of those eligible to receive the vaccine. We begin to see some slack in the first dose appointment utilization by our seniors, and so we're prepared starting this weekend on Saturday to open up vaccinations to our school and child care sectors, our education and child care sectors, our non-medical emergency responders, and our food and agriculture sectors. Now, I want to caution that when we do this and we take this next step, we will be opening up vaccines to about 500,000 San Diegans. Between these three tiers, there's about 500,000 folks that fall into these three buckets. There will not be 500,000 appointments available on Saturday, or Sunday, or Monday, or for many weeks coming forward. And so we need folks to be patient. We're not seeing all of the first dosages utilized by our seniors, and so we're ready to move to this next tier. We think we'll be ready to go. We know we'll be ready to go on Saturday instead of Monday, which was the previous plan. But there's going to be considerable strain on the vaccination system and on the appointment system. And so we need folks to understand that as supplies increase, and we do feel confident, particularly in the first and second week of March, that we will see increased supplies of vaccines, which will allow us to make more appointments available. But as we move into this tier, again, we just want to reiterate and encourage San Diegans and let them know as soon as we get vaccines, we make appointments available, and likely as soon as we make them available for the next week or 2 weeks, they will probably be immediately gone. And so we will fight to get as many as we can. When we get them, we'll make them available. But we just want to have a word of caution that not everyone in these three tiers is going to be able to get an appointment immediately. It is going to take a little bit. I also wanted to share some of the work we've done, starting with our schools, with our K through 12 schools. We all want to get our kids back in class, and we know that for a number of districts that is dependent upon getting the vaccine, and so we want to get those vaccines to our K through 12 personnel. We want to do it as rapidly as we possibly can. We've been working closely with the San Diego County Office of Education, and Dr. Paul Gothold is here if anyone has questions, and we appreciate Dr. Gothold and his staff. They've been working in partnership with VIBA, and between VIBA and the San Diego County Office of Education, we're creating essentially a closed system for K through 12 school personnel, both teachers and school staff. This system will be run and administered by VIBA in partnership with San Diego County Office of Education, and we as a county will be setting aside not the 10% that the state said should go to K through 12, but 20% to try to get our teachers and our school staff vaccinated as quickly as possible to help facilitate reopening and getting all of our kids back in school. The way it will work is essentially County Office of Ed will look at those school districts that are open or have a plan to open pending vaccination. They will put those in the queue, and they will prioritize those based on zip code, meaning the communities that have been hardest hit by COVID and the school districts in the communities hardest hit by COVID will have priority access, but the aim is to move swiftly through our teacher and school staff personnel so that we can get them open. They will have a website, vibavaccines.com, that has information, but it's really important for our K through 12 community to know you can't go get an appointment. They're going to work with the schools and with the districts, and they will schedule them that way. That website, vibavaccines.com, allows people to sign up for alerts and information. But for K through 12 communities, your school and your district will be contacted by the County Office of Ed and by VIBA in order to schedule and facilitate that appointment. It won't go through our normal public network or My Turn or Vaccination Superstation. We've built a closed system, and we're going to prioritize, again, 20%. If we can do more, we will, to go into those school personnel to get them, and that's how we will be handling K through 12 vaccinations for teachers and staff. And again, we greatly appreciate Dr. Gothold and the County Office of Education and VIBA, along with all of the school districts throughout San Diego County. And we need to be patient as they get this up and running. There's going to be some tweaks and some bumps and some things they have to do, but our goal is to, as swiftly as possible, get those folks vaccinated. If you are in the education and child care sector, but you are not related to K through 12, your community college or higher education or child care, then you will go to vaccinationssuperstationsd.com, and you can go to any of the pods that we have available and work to get an appointment through that. For non-medical emergency service workers, those folks can also go to Vaccination Superstation SD and access any appointment at any one of our sites. And Scripps Health has volunteered to step forward and help us vaccinating, in particular, our law enforcement personnel. Scripps Health will be working with each of those agencies to schedule those and get those folks in and vaccinated again, starting as early as Saturday morning. But anyone in that tier, non-medical emergency service workers, can go to the county website and work to get appointments that are there. And then our food and agriculture sector, which is nearly 400,000 workers across our county, those individuals can also go to Vaccination Superstation SD and go to any of our sites that are out there and available. We are working in particular with our grocery stores and pharmacies about how we can provide some additional allocations so they can vaccinate their own workforce on site, which we think will be more convenient and easier for them. But again, we are excited to take this step forward. We ask for everyone's patience. K through 12 teachers, staff, school personnel will go through the County Office of Ed and VIBA. They will be scheduling, they will be administering, those will be beginning Saturday. They will take schools open or with a plan to reopen, and they will try to prioritize those districts as best they can by zip codes, with the hardest hit communities getting priority, and they will be scheduling those directly with the districts. Folks can go to that website to sign up for more information. If you are not K through 12 but education and child care, you go to the county website, sign up for an appointment, and show up. Non-medical emergency service workers, you can go to the county website and sign up with appointments starting Saturday. And food and ag, you also can go to the county website and sign up. Our CAL FIRE teams for food and ag will be going into the fields to vaccinate our farm workers and trying to reach those communities which are hardest to hit. And again, just reiterating once more, the slack in appointments will be gone starting Saturday morning. They will go very quickly. And so we just encourage everyone to be patient as we move forward. We will continue. I mentioned we vaccinated about 68% of our seniors. We will continue to make all of our sites available to seniors. About 165,000 remain. And our efforts around dedicated sites for our community health workers reaching hard-to-reach communities, they will still have priority access into vaccine appointments, along with 211 for seniors who don't have technology. They will have access into vaccines, and we will, of course, continue to prioritize second dosages moving forward. So a lot of forward progress as it relates to vaccines, and we're encouraged about where we're headed. When it comes to youth sports, obviously the state put out revised guidance that we think is appropriate at this time with the improving conditions we're facing. The cutoff is you can resume competitive play for outdoor youth sports when you hit a case rate of 14 per 100,000. We barely missed it this week. We were at 15. We have a high degree of confidence that next week we will be at 14. All of the youth sports can resume non-contact practices now. And if we hit 14 or lower next week, then they can resume competitive play and contact sports. And so we're encouraged about the prospects there, and I know everyone is looking forward to that. And then we will continue to monitor our progress in terms of descending into a lower tier and moving in and having more things reopen. So in general, case numbers are good. We need to keep that going by doing the things we've been doing to get them low. Vaccines continue to be administered, and we have some optimism that the supply of vaccines is going to increase significantly, particularly as we get into March. And we've continued to build out our infrastructure with more superstations and more pods to be able to, when that supply significantly increases, to be able to, with the flip of a switch, provide more appointments and be able to provide more vaccines. So we're very encouraged by where we're going. Again, special appreciation and thank you to Dr. Paul Gothold, to VIBA for their help on K through 12, and to Scripps Health for their help on our law enforcement personnel. With that, let's jump into our charts for today. Here you just see a quick map of all of the sites, vaccination sites and locations that are out there that you can see on there, both the superstations and the pod. Again, we're trying to place these in the communities that have been hardest hit and most impacted and continue to build out the infrastructure. Even though we haven't had the supply to support it, we want to build out the infrastructure so that when the supply increases, we are ready to go. Next chart here is just a quick run through. Right now, we're still doing healthcare personnel, long-term care facility, staff and residents, and those 65 and older. But starting Saturday, we will open appointments to emergency services, education and child care, and food and agriculture. And it will take us a little bit of time to work through this group, but we are excited to do that. And then, of course, on March 15th, we will be opening for folks with underlying health conditions. And so we've got a few weeks before we hit that point, but that will also be coming March 15th. Next slide. Here you just see law enforcement service sector. Law enforcement only is being aided and assisted by Scripps Health. K through 12, TK through 12 only is being administered by San Diego County Office of Education in partnership with VIBA. And our food and agriculture sectors for farm worker is being handled by Operation Collaboration and CAL FIRE, which will be going into the field to do that. Every other group will be able to access our public portal and our public listing of sites dispersed throughout San Diego County. Next chart. Here again, you just see our T3 numbers. Again, testing coming down, generally just less demand for testing. The supply remains there, but you see that there. Next. Here you have our number of cases. There you see there, again, we remain low. The percentage of positive is 4, and that purple line is descending and trending down. And you see the number of cases, again, kind of bouncing a little bit up and down, but again, staying remarkably low compared to where we have been. Next. Here again, hospital census descending, both COVID ICU and COVID-related hospitalizations. This is encouraging. This obviously follows a lag in the number of cases coming down. And ICU capacity, again, you see the number of COVID numbers coming down. Hospital systems continue to catch up non-COVID related ICU utilization, but again, encouraging trends with more ICU beds staffed and available on a regular basis. Next. Fortunate loss of life yesterday, 29, today 12. We're now at 3,230 San Diegans who have lost their life from COVID-19. And this is just where we are in the tiers. Again, you see that adjusted case rate at 15. We are descending rapidly and moving quickly. We hope that this gets 14 or lower next week for youth sports, and we will continue on our progress towards the red tier. And that is our final chart. With that, I want to turn it over to Supervisor Vargas, who will give her update, and then we'll go to questions. Dr. Gothold is here from San Diego County Office of Education if there's questions, along with Dr. Wooten, our Public Health Officer, and Dr. McDonald.
Thank you, Chair Fletcher. Good afternoon, everyone. Just a quick reminder that all of the work that is being done continues to be done from an equity lens. Our Project SAVE initiative, it's a pilot program in the South Bay, continues to be working well. As many of you know, the lack of vaccines in the last week had an impact on the number of appointments that we were able to set up for our communities. However, the model is working, the system, we continue to make sure that we are we're continuing to have the resources necessary so that Project SAVE, which is scheduling appointments for our folks, is actually working. 211 continues to function to ensure that we are able to fill out the appointments for our communities as well. And what's really critical, I think, and I want to give a shout out to some of the local legislators, including my Assembly member, Lorena Gonzalez, who are working really closely with our office to make sure we're actually making appointments for some of our folks. And so what I want to remind people that this is something that we're going to have to figure out how to do together. It's going to take all of us to ensure that we put a vaccine in every person's arm. And so we're working on the policy, we're working on the infrastructure, but I think now more than ever, we're going to have to work with each other and our neighbors and our community partners to ensure that we are busting the myths about why the vaccine actually is really important and people should have it. We actually created a fact sheet that we have distributed in English and Spanish to ensure that folks have the correct information, and we are making sure that everybody has a vaccine in their arm. Gracias primeramente al presidente Fletcher. Hoy venimos con ustedes con muy buenas noticias. La tasa de casos de COVID está bajando, las hospitalizaciones están bajando también. Y aún con las interrupciones que hemos tenido al obtener las vacunas, ahora hemos vacunado casi al 68% de las personas mayores de 65 años en el condado de San Diego y estamos avanzando de manera constante en nuestra lucha contra el COVID-19. También estamos viendo más disponibilidad en citas para las vacunas y es por esta razón que vamos a abrir aún más citas a partir de este fin de semana. Para todas aquellas personas del tema de reabrir las escuelas, sabemos que para nuestras comunidades en particular es un tema muy importante porque queremos que nuestros niños vuelvan de una manera segura. El Estado está recomendando que se reserve el 10% de las vacunas para vacunar a los maestros, pero aquí en el condado de San Diego queremos hacer más, entonces vamos a dar casi el 20% de vacunas directamente para los maestros y todo el personal educativo. El gobierno del condado de San Diego, la doctora Wooten y el presidente de la Junta de Supervisores, Nathan, todos nosotros, el equipo y yo estamos comprometidos en hacer todo lo que sea posible en nuestro alcance para vacunar a los maestros y hacer que nuestros niños regresen a la escuela seguramente. En coordinación con la Oficina de Educación del Condado de San Diego, los maestros comenzarán a vacunarse a partir de este sábado. Las escuelas se comunicarán con los maestros para programar la vacuna, así que les pedimos por favor que los maestros trabajen directamente con sus distritos escolares. Les pedimos que por favor vayan a los centros de vacunación, no a las superestaciones, ya que sus vacunas se distribuirán a través del sistema escolar. Les avisamos que si un maestro intenta ir a uno de esos centros será rechazado, así que es muy importante porque tenemos más de 52,000 trabajadores en el sector educativo, de la primaria al 12. Si usted es maestro, si le va a tocar la vacuna, pero les pedimos la paciencia y que esperen la llamada de su escuela. Sabemos que todas las personas quieren tener la vacuna, los maestros en particular, pero por favor esperen a que su escuela les hable. Estamos también muy contentos de por fin poder abrir las vacunas este sector, porque en realidad sabemos que es fundamental que nuestros hijos vuelvan a la escuela este año. Nuestros niños necesitan la atención directa de sus maestros, la amistad de sus compañeros de clase, y nuestros padres de familia necesitan la oportunidad de concentrarse en los trabajos y sus rutinas diarias. Nuestras empresas necesitan toda la atención de sus empleados, los negocios pequeños alrededor de las escuelas necesitan este impulso financiero que viene de los maestros que van a trabajar estos días. El otro grupo de personas que van a recibir su vacuna son los trabajadores de servicio de emergencia que no son médicos. Estamos emocionados de abrir las vacunas para el personal de servicios de emergencia. Estos trabajadores brindan servicios críticos de todas nuestras comunidades y estaremos reservando el 10% de nuestro suministro de vacunas a este sector. Para recibir una vacuna, Scripps Healthcare trabajará directamente con las autoridades policíacas para programar sus citas. Para aquellos trabajadores de servicio de emergencia que no pertenecen a una agencia policíaca, pueden inscribirse para su cita a través de vaccinationsd.com y pueden ir a cualquiera uno de sus centros de vacunación comunitarios o superestaciones. Tenemos más de 30,000 trabajadores en el sector de servicio de emergencia y no médico y esperamos que estos trabajadores sean vacunados lo más antes posible. El tercer grupo es el grupo de la comida y agricultura. En el condado de San Diego tenemos cerca de 400,000 trabajadores en la industria de preparación de alimentos e industria agrícola, pesquera y forestal. A partir de este fin de semana abriremos citas también para este sector. Los trabajadores pueden programar su cita en vaccinationsd.com y luego vacunarse en uno de nuestros centros de vacunación comunitarios o las superestaciones. Es muy importante reconocer que va a haber muchísimas personas queriendo tener vacunas y tenemos todavía ocupamos la paciencia de las personas para poder hacer esto. Así que nos da mucho gusto informarles sobre el progreso significativo que hemos tenido y seguimos trabajando para que todo el mundo tenga vacuna en sus brazos lo más pronto posible. Gracias.
Thank you, Supervisor Vargas. Real quick, I want to bring up Dr. Gothold in a second. I want to correct one thing. The website is vivavaccinates.com, vivavaccinates.com. So as we have these three groups that we're opening up, education and childcare, emergency services, and food and ag, all of them except K through 12 will go to our normal website and get appointments just like seniors have done and like healthcare workers have done. But for K through 12 staff, again, just to reiterate, that's a priority. We're allocating double what the state has outlined to get this population done to help facilitate school reopenings and get people back in class. But K through 12 personnel will not go to the normal websites. The County Office of Education, working with VIBA, will be contacting the schools and the districts and scheduling them. Again, schools that are open or have a plan to open, they're going to work through those on a priority basis based on zip codes that have been hardest hit by COVID. And our aim and intention is to get this population done as quickly as we can. So K through 12 teachers and school personnel will not be able to go to our normal pods. They will wait. They will be contacted when there's an opportunity for them to get vaccinated. We just ask them to be patient. We're making this a priority. We're building out capacity and a dedicated system for teachers. And so we ask for everyone's patience as we work through that. But again, the website with information, and you can sign up to get alerts, but you cannot sign up for an appointment. Really important, the VIBA and the County Office of Ed will work with the school districts to schedule appointments. You just got to stand by until they reach out and contact you, and we'll try and provide a lot of vaccines into the system. Everyone else, again, can go to the normal county website and schedule appointments as they become available starting Saturday morning. For these new groups, they'll be available Saturday morning. So with that, I want to welcome my friend Dr. Paul Gothold. I appreciate Dr. Gothold. They've been working with us from the very beginning of this. We ask a lot of them. We throw a lot at them. And they always come through. And this is going to be difficult. There's a lot of folks, and there's a lot of moving parts. It may be a little bumpy, but we know they want to be a part of getting this population vaccinated and getting our kids back in the classroom, and we appreciate their work.
Thank you so much, Supervisor Fletcher, Supervisor Vargas. I appreciate the opportunity to be here. This is an important step forward for our school communities. Working with the County of San Diego, VIBA, and following guidance from the state, we are in the process of creating a system that supports schools while addressing COVID-19 health inequities. As the supervisor mentioned, that process will include schools that are open, plan to reopen, and doing that crosswalk or mapping into those zip codes which have been adversely affected. And subsequently, vaccines will be made available to school employees working in person in areas with lower rates of infection, hospitalizations, and death. Because the county is operating with a limited supply of vaccine, again, we hear this, we want the community to bear with us. We ask for patience as we work through this process as efficiently as possible. Meanwhile, the work of reopening our school campuses continues to move forward. San Diego County districts and schools continue to plan and prepare for the return of students to in-person instruction on timelines that are specific to health conditions and the needs of their respective school communities. I want to end by thanking the County of San Diego and VIBA for their support in swiftly vaccinating our region's teachers, classified employees, and administrators. I especially want to call out the fact that even though there's a 10% set aside that the governor in the state of California has mentioned specifically for K-12 education, that the ongoing commitment of our Board of Supervisors in this county to double down on that and allocate 20% speaks volumes, and we appreciate their support for our schools. I want to thank all of our school employees for everything they're doing to connect our students and families under these very difficult circumstances. We appreciate your hard work, what you are doing, and everything that you do, and we promise we will get you vaccinated as quickly as possible. Thank you so much.
At this point, we'll go to our questions, and Drs. Wooten and McDonald are here for questions as well.
Our first question is from Melissa Macia with ABC 10 News.
Hi there. I actually have two questions. The first one's either for Dr. Wooten or Dr. McDonald. When we're hearing more about this California variant with a study coming out saying that it could be more transmissible, questions about how it will affect the vaccine, how concerning is that, and are we tracking this variant here in San Diego?
Yeah, we'll have Dr. McDonald address that question.
Yeah, thank you for that question. I have not actually read that specific study, but we do know that the so-called California variants, or B1, 429, and 427, have been increasingly detected in Southern California. I believe the Los Angeles Health Department reported that the majority of their cases were this variant. We have seen this variant here in San Diego since the end of last year, and according to the most recent information that I've gotten from our partners who are doing most of our whole genome sequencing, the Scripps Research Institute, they estimate that about 30 to 40% of the cases that are being detected in San Diego likely have those California variants, about 50% each, actually. We don't really know whether this variant is more contagious than the others here in Southern California, but it's gratifying to know that the overall numbers of cases are going down. And so even if it is a little more contagious than the other ones that are circulating in the community, the take-home message is the same, that you need to do all the things that we've recommended to prevent transmission. So wearing masks, social distancing, staying at home, and those precautions. So did that answer the question?
Yes, thank you very much. I appreciate it. I do have a second question. We received some information hearing that our military locally doesn't have enough vaccines to get second doses, and from what we've been told, they've been told to go out into the county, but they're having problems with appointment. Is anyone in the county aware of such an issue? If so, is the county able to help our military members?
I'll ask Dr. McDonald to address. I mean, the operating assumption from the beginning has been the federal government and Department of Defense are handling their populations, and so I'm not aware of that, and I don't know if Dr. McDonald is.
No, we're in close contact with our partners in the military, and they are, in fact, responsible for and vaccinating their active duty population. There have been a few specific anecdotal reports of specific active duty people coming to some of our vaccination stations, but they have been redirected back to the military, and I'm unaware of any vaccine shortages amongst military members at this time.
Thank you.
Next question.
Jonathan Wilson, San Diego Union Tribune.
Hi, thank you for taking my questions. I have two questions related to vaccine supply. Supervisor Fletcher, you mentioned that the county is expecting supply to increase over the course of the next 2 to 3 weeks. I was just curious to know, are you guys actually getting those 3-week look-aheads in terms of supply that the Biden administration has said that they're providing states and territories? So just trying to get a sense of how far in advance we know what's coming. And then a second vaccine question. On Friday, the FDA is going to have an advisory panel vote on recommending whether or not the agency give an emergency authorization for Johnson & Johnson's vaccine. So conceivably, a couple of days after that, the FDA could authorize that vaccine. There will be another vaccine coming to San Diego. If that happens, if and when that happens, how are we going to work in that third vaccine into the region's rollout? How are you guys planning to handle those doses, and where would they go? And do we have any preliminary sense of how much of that first shipment could actually come our way?
Yeah, and I'll ask, I'll have Dr. Wooten join because there's been conversations about the J&J vaccine. But let me take your first one. Jonathan, we're optimistic that the supply is going to increase in the coming weeks because, one, there's a kind of catch-up of some of the stuff that was disrupted by the storm. We've also been told the manufacturers have been able to ramp up manufacturing, and we think that will increase the supply. And then the hopeful emergence soon of the J&J vaccine, which will add to that supply and, again, provide the benefit of a single dose, full utilization, just one shot and you're done, which could be very useful to augment in terms of what we're doing. There are ongoing conversations about how you best utilize the J&J vaccine in the context of others, but I think in general, the presence of the J&J vaccine will make things easier rather than harder. Right now, it is a challenging situation with two different vaccines that both require 2 shots at 2 different intervals from one another when you're trying to administer multiple sites. And so I think there will become a little bit of ease that happens. To answer your question specifically about a 3-week look ahead, we do not presently receive a 3-week look ahead. We're lucky and happy if we get a 3-day look ahead for what's coming. And so, but we're going to do the best we can with what we have. And when we get them, and as the last few weeks have shown us, just because you're told they're going to arrive on a certain day doesn't mean they actually arrive on that day. And so we operate in the reality of what we have, and when they show up, we move with every speed we possibly can to quickly get them in arms, and we'll continue doing that. And we hope that the supply not only increases, but we do hope to get some predictability looking out. It'll make it easier to schedule longer intervals. It'll make it easier to plan, and it'll make it easier to set some expectations with the public. But we're going to continue doing the best we can with what we have when we get them. So let me ask Dr. Wooten if she has anything on the J&J vaccine.
I thank you for the question. I actually don't have any additional information. I can just summarize again, is that the advisory committee is going to be reviewing the EUA application on Friday. And if the same process that occurred with Pfizer and Moderna occurs, we will see additional vaccines on Monday. To echo what Chair Fletcher stated, we don't know the amount that we're getting. I'm sure in the next several days we will know that information. We order vaccines about twice a week, and we typically do not get the full allocation, usually somewhere between 25 and 30%. So that's where we are, and the good news is that we should have additional vaccine, 1 dose vaccination, which is really great for vulnerable populations, does not require the ultra cold freezer support for as the Pfizer vaccine requires, and it's really would be a great vaccine to take out into those locations to vaccinate individuals that are hard to reach, like homeless individuals, much like we did when vaccinating hepatitis A. So we look forward to a more vaccine next week, but we don't know how much. Thank you.
Okay. Thank you both for those.
Thank you. Thank you, Dr. Wooten. Thank you, Jonathan. Next question.
Mackenzie Elmer, the Voice of San Diego.
Hi, thanks for taking my question. I was curious, are universities bound to the same vaccination phases the county sets, and why or why not?
I'm sorry, Mackenzie, what do you mean, are universities?
Like public universities, are they bound to roll out vaccines to their own faculty, staff, students based on the phases the county sets?
But the teaching part of the university or the healthcare part of the university?
Good question. I guess.
Like, I mean, I just want to understand your question. Like, the part of a university that teaches doesn't really administer vaccines. The part, if they have a health system tied to them, then I think that they would follow the tiers. But again, that would be based on what their health system decides as their prioritization.
I guess our university students and faculty and staff, I mean, you talked about K through 12.
Oh, or the
being-
individuals. Okay.
they're
Okay. So,
green.
yeah. So universities are in the education sector, but it's not for students. It's just for workers. So if you are a educator at a institution of higher education, then the vaccine will be available to you starting on Saturday, if pending you can get an appointment. So it isn't students, but staff at institutions of higher education are a part of the education sector, just like staff at K through 12 are a part of the education sector.
Okay.
Does that
so
answer
they have
your
to
question?
follow the county's guidelines. Okay.
Yeah, yeah, and they follow along with this. That's right.
Okay, thank you.
Yep, thank you.
Our next caller is Alexis Rivas, NBC7.
Hi, good afternoon. So we were looking at the numbers of vaccines administered by the county broken down by zip code. And we had seen that 22,664, I think at last count, had gone to patients that had an address outside of San Diego County. Where are these vaccines going and how is that happening?
Yeah, so 22,000 out of what we've done would be less than 2% of the total of vaccines have been administered, and it is most likely going to people who work in San Diego County. We have, for instance, we saw a lot of healthcare workers. They're travel healthcare nurses. They're here in San Diego. They're working every day in San Diego County, but their residence might be in some other location. You also could have someone who works in San Diego every single day at a long-term care facility or at a healthcare facility, but maybe they live in Riverside County. And so we think the overwhelming majority of those are individuals who work in San Diego County, but their residence might be somewhere else. But again, it's a really, really, really small percentage of the total.
Yeah, I mean, yeah, but it's still a significant number, I would say. I mean, it's more than any zip code within our county. I think the highest is like 14,000 something. I mean, are we saying that do we know, are we tracking that? I mean, are you saying that there's 22,000 travel nurses that are working in San Diego County right now?
No, and Alexis, I didn't say that. Now, what I said is out of 22,000, out of almost 800,000 is less than 2%. But if an individual works here every single day, and they're here every single day and they can get the vaccine, then that is okay. And we think the overwhelming majority of a really tiny percentage of the total are going to people who are outside the county because they most likely are here. A travel nurse is an example of the type of person who could be here, who could be working, who could have a residence somewhere else. It also could be, again, someone working in a healthcare facility or a senior home. Maybe their residence is in one of the surrounding counties, but they work here. And so we think that the overwhelming majority of that very small number of the total is tied to individuals who work here but do not reside here.
If you could just allow me one follow-up too, is the county tracking that?
Are we doing what?
How do we know? Are we tracking where they're working? I mean, how can we confidently say that? Is there like a breakdown of the zip codes for the out-of-jurisdiction vaccines that we could see?
I don't know. We can look into it. I mean, it's again, we're focused on getting the vaccines administered, and you know, this is way less than 2% of the total, so I don't know it's a significant problem. But our sites do everything they can to make sure that people are consistent with the tiers that are open, and I think that they're doing a very good job of doing that.
CBS 8.
Hi, thank you for taking my question. I have two. The first is Blacks and Latinos make up less than 20% of those who have received the vaccine, yet they're more likely to be hospitalized and die from the virus. Last month, the county was saying this was a reflection of the healthcare worker makeup, and it would balance out as seniors got the vaccine. I'm wondering why this is still an imbalance. And then speaking of imbalances, we're hearing about the hours-long lines at Petco Park, the vaccination superstation there, and then Chula Vista's seems to be pretty open. So why is there an imbalance at the superstations when it comes to appointments?
Yeah, I think what we've said, Brandon, was that the demographics of healthcare does not match the demographics of the county as a whole, and the demographics of the county as a whole do not match the demographics of cases. It really is three different sets of numbers. The demographics of seniors also does not match the demographics of the county as a whole. It is not as diverse, and certainly not as diverse as the demographics of cases. And so a lot of that is presenting a challenge in terms of people will look at the breakdown of cases and the breakdown of vaccinations and say they don't match, but it is two totally different populations. You've got to look at the population we're presently vaccinating. The largest driver of cases is young folks. And 26, 27, 28-year-olds are not in the queue to get vaccinated. And so that imbalance between cases and vaccinations is likely to exist for quite some time until we get to the general population of healthier, younger individuals who are out and about. We are doing a lot, and we need to do more, and we need to do it better to try and address those issues in the Latino community. Supervisor Vargas has outlined some of the things. We have community health workers who are out in the community with dedicated spots. Yesterday, I tracked the 211 numbers daily. Every Spanish-speaking caller who called 211 got a person on the phone with an 18-second wait time, and those folks are able to be connected into appointments. We have mobile teams that are going into the hardest-hit communities and trying to reach folks. We're opening up more sites. We're going to begin testing and piloting some walk-up sites in the Latino community where they won't need appointments. We're working with partners. I was on a call early this morning with all of the South Bay mayors. We're working with them, taking suggestions, trying to reach the community. And so we're going to do everything we can to keep fighting to get this vaccine into those hardest hit communities. But it just is important to look at the different populations that we're talking about. We have to do better, and we have to do more. And I think also compounding it is the significantly large number of unknown or other races that are showing up in our systems. They may be people of mixed race, but again, that could be skewing our numbers as well. But everywhere, I've talked to folks in other counties and other places, and everywhere is having similar struggles. And so we're working really hard and intentionally to try and address these issues. But ultimately, the rate of vaccines will not match the demographics of the county as a whole or the case rate until we get to the general population. But we're going to continue fighting to do everything we can in there. On your second question on hours, it could just be the availability of vaccines. We've had instability. We've had a big shortage of Moderna. So we've been canceling second dose appointments for Moderna while people are opening up new first doses of Pfizer. And it's just what comes in and when it comes in and what people have available. As we have more predictability about what is coming into our region, then I think we'll have a better ability to kind of smooth that out and make it a little bit more even.
And just to clarify something, so if somebody were to get like the Moderna vaccine, the first shot at Petco, could they go to the South Bay Superstation and get a Moderna vaccine there as long as it matches Moderna, Pfizer?
They could. They could. We encourage folks to go back to the same site. It's a little bit easier. But as long as it's the same vaccine, then they absolutely could.
Thank you, Supervisor Fletcher.
Thanks, Brandon.
Matt Hoffman, KPBS.
Hi, how's it going? Just wanted to confirm. So you said that this new group, it does include police officers, and they're going to be handled by Scripps Health. And so starting on Saturday, police officers and teachers and all of them can start. I mean, obviously teachers, you said, will be reached out by the Office of Ed, but they can start this weekend?
That's right, Saturday.
Gotcha. And then I know, a lot of first dose appointments. You said that the new site in Otay Mesa yesterday was the only one taking first dose appointments. So along those lines, what makes you so confident that we have a stable stream of supplies now to get these 500,000+ people while also vaccinating the seniors left over?
Well, we just haven't seen we're seeing more slack in the system. And so when you see slack in the system, I know the Chula Vista site has had some slack in appointments that are there. And so we just are seeing some slack in the system as it relates to appointments, and we're also seeing increased shipments and increased arrival of more vaccines. And so we think it's appropriate. We think we have multiple sites that will be able to get a fair number of these workers done on Saturday. And so we're just at that point where, when we started with healthcare workers, we waited till we saw slack in the system. We opened up 75 and older. We saw slack in the system. We opened up 65 and older. And we are seeing some slack in the system, and we're seeing increased shipments as they catch up. And the combination of those two, I think, puts us in a position where we can go to this next tier. But again, Matt, it's really important, folks. Folks have to understand that we're talking about opening up 500,000 eligible folks, and we will not have that many appointments or that many vaccines. And so we're going to be back where we were at the beginning, where people have great frustration because the appointments are either gone as soon as they're put up or they're not available. And so we're just asking for everyone's patience. We can't make appointments available for vaccines we don't have, and we didn't design the system. This is how it is, and we're going to open up to this group and move forward. And so we just ask for folks' patience as we work through it.
And I know just one other quick follow-up. It all depends on supply, but do you guys have a goal of how quickly you want to get through this, like a month, 2 months, or?
Yeah, as soon as we get the supply. I mean, as soon as we get the vaccine. Well, no, but Matt, I can't speculate on how. We just said we don't even have a 3-week look ahead, much less a month look ahead. We barely have a 2 to 3 day look ahead. So I can't predict at what point we're going to receive enough vaccines to complete the second doses and do this whole population, because we don't know what we will get or when we will get it. We know we're at a point now where we have slack in the system, and we're going to open it up to teachers and childcare and emergency service workers and food and ag. But again, we just have to see what happens with the supply in terms of how quickly we can work through this group.
Jill Castellano, iNewsSource.
Hi, thanks for taking my question. I'm calling in about a story my colleague and I wrote earlier this week about the county's COVID-19 hotel, the Crown Plaza in Mission Valley. We talked to staff and employees. They told us the guests aren't getting proper care, the food is inadequate, they aren't receiving medications on time. There were complaints about security harassing the guests. And 2 hotel employees told us they had never seen anyone from the county conducting site visits there. So I'm wondering, does the county have any plans to increase oversight of the Crown Plaza, or perhaps reevaluate its contract with Equus, which is the company operating the hotel?
Well, our county staff does go on site, and we do inspections, and we take any complaints seriously. We got a complaint about food, we changed that out and tried to improve it. As we have problems with security, we work to try and improve it. It is a very challenging situation and a very difficult situation, but we will continue to strive to do everything we can to make every possible improvement, tweak, or change to make that as successful an operation as possible. So in everything we do, we daily look for an opportunity and a way to do better, and that's true with everything we're doing in COVID, and that'll certainly be true in this situation here.
Paul Sisson, San Diego Union Tribune.
Thanks for taking our questions today. My first one is a little pedantic. So you said that we have 3 different groups: law enforcement, TK to 12, and farm workers. You said law enforcement is going to be handled by Scripps, and then education is going to have their own website, and the farm workers are going to be handled by the San Diego County Fire Department, who are going to, I guess, go out into the field and administer these vaccines.
Yeah,
I'm
no,
a little confused.
Paul.
You also said, go to the regular sites for the law enforcement and farm workers. Is that actually accurate, or?
No, let me walk you through this again, Paul. We got childcare and education. That is a large sector. Childcare and education. That includes higher education. It includes childcare. It includes K through 12. Childcare and education. Out of that, K through 12, just K through 12. It's going to be handled by the County Office of Ed and VIBA, and they will be doing that. All of the other folks in that grouping can go to the normal website and get appointments. Then you have emergency service workers, which includes a lot of things. Emergency service sectors includes a lot of things. They can all go to the county website, sign up for an appointment, go to any of those locations. Scripps Health will be helping with law enforcement and getting those law enforcement in and getting those done. But all of those folks can go. And then food and agriculture includes almost 400,000 folks. Those folks can all go to the county website and do that. We will be taking CAL FIRE and Operation Collaboration into the fields to vaccinate farm workers because it's unlikely and unrealistic that most of those farm workers will be able to get an appointment and get to one of those sites. Does that provide greater clarity?
I guess the question is, with scheduling, if you're going to the regular website, how do the law enforcement make it to Scripps and the farm workers make it to the fire folks?
Well, Scripps has relationships with law enforcement agencies, so Scripps will work with those agencies to schedule those individuals. And farm workers, when they're in the field and CAL FIRE shows up coordinating, then they will provide the vaccinations in the field.
And then I had a second question, and this one might be a little more for Dr. Wooten. It has to do with visitations in our hospitals. We've gone a year now with loved ones unable to visit their other loved ones who are hospitalized. We've seen the hospitalization rates come down quite a bit. Yesterday I saw we were under 200 collective COVID patients in ICUs. At what point will it be time to relax these visitation rules?
Well, Paul, and for everyone else listening to this briefing, we're still in the purple tier. So when we reduce to a lower tier, we will have discussions with our healthcare systems to determine if we will allow visitations again. But we've done a great job here locally, our healthcare systems, at managing a very tough situation over the holidays. So we will get there, but we still are reporting 500 to 600 cases daily now. So it's too soon to start easing up on strategies that we've been implementing to help ensure that we have the capacity that we need to take care of all of those individuals that succumb and are infected with COVID-19. So as...
To follow up.
Yes, go on.
I just wondered in terms of why these visitation restrictions were put in place in the first place. I had some sense that that was to protect the staffs from getting infected as people came in and visited. But certainly now everybody at the bedside is pretty much well vaccinated. So I just wonder if that might change the calculation a little bit.
We are over a year into this, and that is a very obvious strategy that we implemented. It is not only to protect the staff, but to protect the patients that are in the hospital. So that has been a life-saving strategy, one recommended by the Centers for Disease Control and Prevention. We implemented it very early on, in March, actually, of 2020. So we are maintaining that strategy and until further notice. Thank you.
Thank you.
C7.
Good afternoon. So just again to wrap up in regards to this new vaccine eligibility, this means that San Diego County is moving into phase 1B tier 1. I noticed on the website, of course, under phase 1B tier 1, we first had the 65 and up, and now we're having this three-part group.
That is correct.
And so beyond, in these groups, beyond the emergency workers, beyond police, who else is included there? And same under food and ag, beyond the farm workers and grocery store workers, what are other examples of folks in these groups?
Yeah, we'll have a detailed breakdown of kind of each sector up on our website today and this evening. But in food and ag, you have a lot of folks associated with restaurant workers, food manufacturer employees, individuals that are supporting the sanitation of food manufacturing and process workers in cafeterias. I mean, there is a whole sector of folks around food and agriculture and the food industry in general. And so all of those individuals will be available, but there's about a 2-page kind of bullet point of all of that. That will be up on our website. Obviously, education is education broadly. Childcare, K through 12, higher education, and those institutions there. And then emergency service workers or a whole variety of service workers, basically non-medical emergency service workers. These are obviously law enforcement, hazardous material response, search and rescue, 911 operators, and a whole bunch of folks, emergency operation workers, a whole variety of folks who are tied up in those, and we'll get those detailed bullet points up on our website today.
Excellent, and this will be Saturday.
That's right. Yeah, they'll be available to make appointments starting Saturday morning.
Awesome. Thank you all so much.
Thank you. Thank you.
Tommy Sablan, KUSI.
Hi, everyone. Thanks very much for taking my call. Supervisor Fletcher, I have 2 questions. I love that steps are being taken to vaccinate our teachers as quickly as possible. Thank you very, very much for that. Richard Barrera was on this morning stating that the teachers union will require every person in and around the school, from teachers, bus drivers, custodians, to be fully vaccinated in order to open schools. Is that accurate? Do you agree with that?
You would have to ask Richard that, Tommy. You're asking me to comment on a conversation you have with Richard. I wasn't a part of that conversation, so I can't speculate on what he told you.
Okay. And then my next question, hopefully you or Dr. Wooten can help me understand this. I believe, according to the charts, we're at 15 per 100,000, and there's 7 to get to the red tier. Can you help us understand why the 14 per 100,000 is the proper criteria for tier assessment? And if your plan, works and everyone's vaccinated by April, do the tiers matter anymore to fully open?
Well, we'll see. We'll see what evolves with the tier structure. Obviously, the tier system was put in place to slow the spread of COVID as it related to overwhelming the healthcare situation. I think there's a fair argument to be made that as we get deeper into vaccinations, that math may look a little bit different, and I think it's certainly possible that the state may come out and revise that. We'll have to wait and see what happens there. And what we know right now is where we are. We know we got to get our case count to 14 so our youth sports can resume competitive play. We feel confident we'll be there next week. And if you look at the trajectory of where we're headed, you can see we are on a trajectory to the red tier, and we suspect that we will also get there reasonably soon. I know it won't be quick enough for a lot of folks that are going to benefit from there, but we're certainly headed in that direction. We keep cases down, we keep doing vaccinations, we're going to continue reopening and working our way out of this.
And it sure does sound like you guys are heading in that direction. And with everything that you guys are doing and planning starting Saturday and everyone getting vaccinated, I sure hope it works. Now, does it concern you at all? Hopefully that target date of April 12th will happen. Is that truly your goal, April 12th? Do you think because of all the, the low supply that maybe it will go beyond that, or are you still hoping for that?
What is the April 12th date?
Or is it, when schools reopen?
Oh, for San Diego Unified? Yeah, we hope that we hit that goal and we get everyone back. We want to get. I mean, I'd love to vaccinate everyone in San Diego County by that date. It is dependent upon supply, but we are making teachers and school staff a priority, and I we're going to do everything we can to get all of them, not just in San Diego Unified, but in all of the districts throughout San Diego County. Get them first shot, get them second shot, or if we get J&J, get them one shot, and allow our schools to open and get our kids back in the classroom. That's where we're working as hard as we can to do that. All right, let's go to our texting questions.
This question is from Jennifer De La Cruz with ABC 10 News. Now that youth and high school sports can resume, how is the county addressing an equity issue of teams having to meet testing standards of collegiate programs? Clearly, not all schools have the same funding to pay for that.
Yeah, I think this references the recent court ruling. No one's entirely sure what that ruling actually means. What it appears the judge said is that youth sports can resume consistent with college or professional sports, which is a standard that I don't think any high school anywhere in America could meet. The standard that is put in place on our professional athletes is exceedingly high. And so we think that youth sports will resume, but under the much less onerous burden of complying with the state guidance, which right now has them able to resume practice for outdoor activities. And we believe next week, if we get to that 14 number, then they will be able to resume competitive play. And so I think the overwhelming majority of youth sports will be reopening and getting going again, but under the state guidance, not under this ruling that seems to hold them to a professional sports standard.
This next question is from Misha DeBono, Fox 5, similar to one that was asked earlier. Researchers at UC San Francisco are now saying the West Coast variant of the coronavirus could be a lot more dangerous than previously thought. The study found this strain to be a lot more transmissible, and it evades antibodies generated by COVID-19 vaccines or prior infection, and it's also associated with severe illness and death. What are you learning about this variant? Is this cause for alarm and the expectation of another surge in the coming months?
Yeah, we'll have Dr. McDonald again address that briefly.
Thanks for that question. I think that was really asked in the live portion already. We are monitoring these variants, and we're concerned about some of them being more contagious than others. But that study, I personally have not read. I don't think it's been peer-reviewed. And we don't have evidence in San Diego that those variants are indeed more contagious or have higher illness and death rates associated with them. That's something that we would have to really look at over time, really at a national level.
Thank you. This question is from Claudia Bucio with Univision, and she's asking for the question to be answered in Spanish, please. The first question is, can you further explain who is included in the food and service sector, servers, cooks, grocery workers, etc.? And the second question is, as we move forward with the next phase, what efforts is the county working on to make sure Latino seniors aren't left behind?
Muchas gracias por la pregunta. La pregunta es específicamente en el sector de servicio de agricultor, agrícola, pesquera forestal, los campesinos. Entonces es importante saber que hay más de 400,000 personas en ese sector aquí en el condado. Vienen siendo nuestros meseros, cocineros, trabajadores de mercado, aquellos campesinos, como mencionaba el Chair Fletcher, van a tener la oportunidad de recibir sus vacunas, van a ir hacia ellos, por ejemplo, en el norte del condado, en donde están la mayoría de los campesinos. Pero la mayoría de ellos pueden ir, y las personas que trabajan en los restaurantes, los que limpian, cualquier persona que esté en ese sector va a tener la oportunidad de hacer su cita para su vacuna, para que puedan tener acceso. La segunda pregunta es específicamente con las personas de la tercera edad de la comunidad latina y quieren saber qué es lo que estamos haciendo con esa comunidad en general. Como lo hemos mencionado antes, las personas de 65 años o más por ahora pueden seguir llamando al 211. Muchas de nuestras oficinas están haciendo las vacunas, las citas para vacunas directamente. Otra cosa que es importante reconocer es que por el momento los bomberos están yendo directamente a los centros de cuidado de largo plazo para asegurarnos que las personas de tercera edad reciban su vacuna. Estos bomberos del condado y las diferentes ciudades lo que van a hacer es van a empezar a ir ahora a los diferentes viviendas en donde viven personas de tercera edad, número uno. Y número dos, pues le pedimos a todas las personas en la comunidad que si tienen algún vecino de la tercera edad, hay que informarles y ayudarles a que hagan su cita, porque es sumamente importante que las personas de 65 años o más de las comunidades latinas salgan y se vacunen lo más pronto posible. Esta tarde, durante el town hall que hacemos, puedo dar más información específicamente en cuanto a cuántas personas latinas de la tercera edad se han vacunado, pero por el momento estamos haciendo todo lo posible con la comunidad y trabajar para que puedan las personas vacunarse. Gracias.
Thank you. This question is from NBC 7 and Telemundo 20. How is the county notifying the people who got their second appointments canceled? There's been some residents who had them canceled by email, but then never got a new date.
Yeah, the individual site that had that appointment will contact those individuals and let them know it's canceled, and then when they have vaccines and are able to reschedule, then they will contact them in that same way. So for that individual, if they haven't been contacted yet again, they're probably just waiting on the arrival of vaccines, and then most likely we'll reach out and schedule that second appointment. That concludes our briefing today. We want to thank everyone for joining us, and check back for regular updates. Thanks.